Jai Shri Krishna, Jai Jalaram to everybody. Welcome to this event today. A very important topic that we'll be talking about today, high blood pressure, a silent killer. I'd like to start by introducing Bharat Bhai Soda, the LCUK President, and Banaban Raja, the LCUK Mahila Chairperson. If I can please pass over to Bharat Bhai Soda to say a few words.
Hello, Jai Shri Krishna Sarvane, and welcome to Lohana Community United Kingdom Mahila presentation on blood pressure. As Jay mentioned, blood pressure is a silent killer, and if it's not controlled properly or not maintained at good levels, it can lead to deadly complications. So, it's one thing that we need to be very careful about. And today, I think we are privileged to have a 28-year veteran, Dr. Deepika Thakrar, a 28-year veteran in general practice, a senior partner at a large practice in Ipswich, which is a multidisciplinary practice. She also trains GPs, and she's also a trainer for medical students of both Cambridge University and UEA medical schools. Besides blood pressure, her interests also include mental health, children, and women's problem. But besides, rather than taking more of your time, I think even I'm interested in listening more about the blood pressure issues and how we can maintain it, preferably without medication, but we'll leave it to Dr. Deepika to tell us all that. So before, not taking much of your time, I'll now call upon Pannaben Raja, the chairperson of LCUK Mahila, to take over. Pannaben and Jai Shri Krishna Sir.
Jai Shri Krishna Badane, thank you, Bharat Bhai. On behalf of the LCUK Mahila Committee, I welcome you all to the health seminar organized by the Mahila Committee. Today, as Bharat Bhai said, we've got Deepika Thakrar, who is going to give us a talk on high blood pressure. I won't take up a lot of your time, but I will request if anyone has any questions to ask Deepika Ben, please put forward your questions on the chat or on Facebook. And we have got Sandhya Ben, Jay, and Raju, who will take on your questions. And at the end, we will put them forward to Deepika Ben for her to answer. I hope you enjoyed the session, and we look forward to hearing you, Deepika Ben. So over to Deepika Ben now, please.
Thank you very much. Jai Shri Krishna, everyone. I know a lot of you, and a lot of you probably know me. I've already been here presenting a talk on diabetes not very long ago. I am a general practitioner, so my not for doctors, but for all of us really, what we do, etc. So I'm going to make it very nicely basic. Please feel free to ask as many or as little questions as you want to. I'll go through talk very slowly. If there's anything that you don't understand, please bring it up, and I will do my best to answer. If I don't know anything, then I always know someone who will know. So I'll do my best. And what I'm going to do is I'll start with a presentation, and I will talk over it. So we'll take it one step at a time. Bear with me. So can everyone see? Okay. Can you hear me well? Can everyone hear me? Okay. So why is it a silent killer? And I will say a little bit about what I'm going to talk about. And what I'm going to say is, what is high blood pressure? Who gets it? Who's more likely to get it? And why do we need to know anything about the high blood pressure anyway? There are so many other diseases. High blood pressure is just one of those. And do we call it a disease? It is, how do we diagnose? What do we do about it? And what are our long-term goals? And some hints and tips that we all can use to make life a lot easier and avoid complications, as you heard that it can lead to a lot worse. And it's the killer bit that always worries all of us. So I'll start with why. So it's for every 10 people who have been diagnosed to have high blood pressure, there are 7 further who have undiagnosed high blood pressure. And these are the people that we really need to target. Of course, once you're diagnosed, you are given all the information from the health services, and you may or you may not take it seriously, but at least you've got a diagnosis, you've got a treatment plan, and you should have some sort of management in your mind, in the back of your mind. Whether someone does it sincerely or not depends. But more than 5.5 million people in UK are undiagnosed with high blood pressure. And considering that it is a silent killer, as I said, the reason we say that is because it does not give you any symptoms at all. It starts very quietly. You can have high blood pressure and not even ever know it before there are any complications. So very, very important to find this group of patients and get them to understand. And we all can prevent that too. So around 1 in 3 adults in UK has high blood pressure. So the incidence is pretty high, really. In England, 31% of the men and 26% of women have high blood pressure. Men are a bit more targeted for high blood pressure and are more likely to get it because I think of the levels of testosterone. Excuse me. Half of the people with high blood pressure are not diagnosed or receiving the treatment. So even if they have high blood pressure, either they think, okay, although it's not very high, I don't need to take treatment. Or they think, the treatment is giving me more side effects than high blood pressure, so why bother about getting any treatment at all? So people do, even if they know they've got high blood pressure, they would consider it at the borderline, so it doesn't matter. So it doesn't matter. And all these myths need to be got out, and really it is important for everyone to be treated. In England alone, there are more than 5 million people undiagnosed. And that's the only reason is no symptoms. We in medical profession always say, how nice would it be? And this is cruel, and it is cruel to be kind, really. So we wish that the blood pressure gave some pain. If it gave pain, people would get the treatment. People would approach, people would take it seriously enough, but it does not give you any symptoms at all. It's a global problem. It's not just us. And 1.4 billion people worldwide are affected. It's not restricted to one part of world or due to any specific reason for either Western or Eastern. 1 in 4 men and 1 in 5 women can have it. 10.4 million deaths are accounted due to high blood pressure or complications due to it. And it's a major cause of premature death. So death before someone should have it, unexpected. So suddenly, due to complications, there'll be death before they even realize that there is high blood pressure. In South Asian, why does it matter to us? Because South Asians have 40 to 50% greater chance of having complications and hence mortality, death, due to complications of high blood pressure. Heart disease is higher in our population anyway. So we are more likely to have diabetes. We are more likely to have high blood pressure related to it. So our arteries are anyway a little bit more affected. The prevalence rate is lower in white. Lower than in white. White population have, or Caucasians have 43.5%. Afro-Caribbeans and us are higher, 55.7. And sorry, we are at lower range, 43.5, whereas white have 47.5 and Afro-Caribbean have 55. So it is a big problem, and it is a worldwide problem. And the reason that we want to take it seriously is because it causes increased risk of cardiovascular disease. Cardiovascular disease are coronary heart disease like heart attack, stroke, kidney problems, and sudden death, really, which is all preventable if diagnosed early. So we really need to get in there, get in early, and diagnose. I think the biggest thing would be, let's do screening and get it diagnosed. So there are, who gets it, gets high blood pressure, and who should be more aware of it. So there are two groups mainly we consider in medical terms. One is essential hypertension, which is in simple terms, essential hypertension would mean automatically. Now, there are a lot of theories we don't know for sure, but some people are more prone to have. So it is hereditary. Some people have tighter blood vessels for we don't know what reason, but they have blood pressure running in the family and they would automatically get it. And in this, hereditary family history would come into it. And second group is secondary hypertension, because the high blood pressure caused due to various conditions. So there could be something like taking certain drugs, certain contraceptive pills, certain anti-inflammatory drugs, which cause sodium retention. Any drug which causes sodium retention would cause it, like ibuprofen, or constantly taking aspirin-based tablets, not low dose aspirin I'm talking about, but I'm talking about anti-inflammatory tablets, which you take high dose for arthritis or something like that every day. Some kidney diseases, secondary to kidney diseases, people can get high blood pressure, and certain syndromes that people are born with, for which we are very unlikely to be able to modify those syndromes. And some of the tumors which cause functional problems, either function of the heart or kidney or something, so they don't function as well. So in blood pressure, it is a multi-organ assessment that needs to be done. So what exactly is blood pressure? So blood pressure is the force of the blood which the heart pumps, and with the resistance of the blood flow in the arteries. So there are two readings. If you take blood pressure, there's a top one, which is usually slightly higher, and a lower one, like 120/80. So 120 would be how much force does the heart pump with. So the blood is pumped and it goes to the brain, through the arteries, in the blood vessels of the legs, etc. So that's the force, and that's 120. And we measure it in millimeters of mercury. So mm, we call it millimeters of mercury. And the lower one is when it's coming down, and how much does the artery resist. So that's why I was talking about that some people are born with very tight arteries. So if a pump forces the blood there and the artery does not expand easily, then it will stay high. So the lower one, when the blood returns, will still be high. Whereas we want nice collapsible artery, तो एकदम low करी ना के तो પછી blood flows easily and goes down. So the tighter the arteries, the worse it is. If they're collapsible and nicely, then the blood pressure would be nice. So we want our arteries to be not so tight. And there are some things that we can change in all this, some we can't change. So why do we need to know this? I will touch base on how we do, but why do we need to do? So because, as I explained, the arteries and the heart has to pump and the arteries has to work. The blood supply to all the organs can be affected if there is high blood pressure. So if there are heart disease, it can cause because the blood does not reach easily, or there's pooling of blood because of high blood pressure. It does not exchange very quickly. So people can get heart diseases, they can get heart attacks, or if it is in brain, they can get brain problems, they can get strokes, they can be heart failure, because if the heart is not coping very well with a lot of blood and it has to pump against a lot of pressure, there can be heart failure. So it's not coping. So thodu mottu thava mande heart kanke muscle develop થાય ને it's trying to cope ને પછી dilate થઈ જાય ઓલા balloon જેવું છે કે we need all the elasticity of it and it needs to pump properly, but because there is high blood pressure it has to work so hard that the elasticity goes, and then that leads to heart failure. Peripheral arterial disease. So peripheral arterial disease is when the arteries in our legs or arms and peripheries get very tight and frozen. So those give you leg pain. So arteries become very tight. Again, this would be secondary to the high blood pressure because the arteries get tired of pumping, or there is scaling of the arteries. Which is the cholesterol and the fat get deposited. Limescale get deposited in the pipes, same way cholesterol and lipids get deposited in the arteries. And the arteries become thick, so it does not. Aortic aneurysm, it can form. Just among artery hoy, because they're elastic, it can just give way. And little balloon and that's what we call as aneurysm. So artery am jati and a so it forms a balloon. So that is called aneurysm, and people are likely to get aortic aneurysm due to high blood pressure. Kidney does lots and lots of work. It is purifying organ of the body. It removes all the mark. It looks after enzymes, angiotensin, aldosterone. But tumari and a kidney gets affected very, very quickly in high blood pressure if there is a constant hard work it needs to do. And unfortunately, there is evidence to show that high blood pressure can, on long term, cause dementia, and it's called vascular dementia. Long term high blood pressure hoy, and there is higher cholesterol, those small strokes go in the brain. You don't even realize, but they cause little areas of atrophy, and this atrophy can cause vascular, what we call as vascular dementia. That part of brain does not work because it's not getting enough blood supply. So there are multiple risks. So it is very important to diagnose. The earlier we diagnose, earlier we can do something about it. Earlier we can get in there and we can say, okay, chair, so these are the consequences I can get without even knowing. So the consequences of all these are something we can see. But the high blood pressure, again, there are no symptoms at all. So we really need to take it very, very seriously and be aware of it. It's not something frightening, but it's something to not ignore. So these are the risks, and that's why it's so important. Sorry, so how do we check? So there are various ways you can check. So you can check yourself. You buy machines, and these days they are not very expensive. So if you buy from local chemist or Argos and things like that, you will get it for under £20 or something. And or you can get it checked in GP surgeries. GP appointments are very hard to get, I must warn you, and it is probably not cost effective to really go, or time effective really. Third is pharmacist. At the moment, government is doing this new contract with the pharmacist. Well, they would be happy to check blood pressure, your weight, and do your health check as well. So they are excellent resource to get your blood pressure. There's a screening done to see. From time to time, there are various health camps organized. So if you get a chance, we had done a health camp, just town center, we had done a little CCG-based camp where people can come and get their blood pressure done. And it's an automatic machine where you put your hand and it checks it and gives you a little leaflet with your height, weight, or at least weight, blood pressure, and pulse. And if the pulse is irregular, then you must take it very seriously and point it out. We'll come to that later on. So health camp is another way to do. Then NHS health checks. I don't know whether you all have heard about it, but we have an excellent system of health checks in NHS So you're offered a free health check every 3 to 5 years from 40 years onwards. So you would be invited by GP surgery to have a health check done. And what they do is they take your height, weight, blood pressure, they will check your cholesterol, either random or fasting, depending on how circumstances are, and they'll check your glucose. Because this is the best way to diagnose anything that may not be in sync or in line, and you can get the lifestyle advice very quickly and get yourself done. So don't ignore the health check letters that you get. Do take them up and do. And some workplaces, I am occupational health physician, so we do have a facility at workplaces. The big companies do always have either a little department with a nurse, or there's a little machine given, or from time to time they have staff incentive, and they send all the staff. So do take advantage if it is from the workplace, but it is screening and you must do. But all adults over 40 should check at least every 5 years. If they're normal every 5 years, please check. Even if it's completely normal, you must check your blood pressure. I think that's one message I really want to get across today. And so how do you check yourself? Because it's so easy nowadays, especially since COVID. We in GP surgeries rarely ever see patients to check their blood pressure. Unless there is major complications, we get them to either teach them how to self-check, or give them machines where they can self-check, or put these 24-hour monitors on them. I'll talk about it in a minute, to check. So checking yourself is very easy. Investment is 20 quid or so for the whole family, which is very good value. I think we should all have that at home. And what would you get? Because there's lots of choice. And who should check? Who's more likely to have problems? So if someone is over 8, if someone is eating too much salt, or do not eat enough fruit and vegetables, do not go do enough exercise, drink too much alcohol or caffeine, smoke, sleep deprivation can cause high blood. Over 65, age unfortunately goes against us. So people, as we get older, our arteries get tighter and the heart is not as elastic as it used to be, and you're more likely to get high blood pressure. And as I mentioned earlier, that if you've got a relative with high blood pressure, or people living in a deprived area are more likely. And the evidence shows that in deprived area, the diet is not good. So there is likely to be high blood pressure and can increase your blood pressure. So what are the machines, as I was talking about, and how to measure? So these are the 2 types of machines, which are the commonest one that you can buy to do your own blood pressure. The one that is on the left is the arm-based, and the one on right is the wrist-based. Now, we prefer the arm-based because wrist, the artery in the wrist can go anywhere. It has to be absolutely located, and it needs to really catch the right thing. Otherwise, you do not get good reading. So if you're going to buy, it is better to buy the one on left, which is the arm-based. And what would you do once you get all these numbers, as we can see on the screen? There are all these numbers. So let's see what we do and how we do. So you take it out of the box. There are usually 4A batteries. I can't share. And it is very important, okay, when you take the blood pressure, you really relax. So your arm should be at the length of the heart. So heart is here. You make sure jetlu straight, get your arm straight. You really relax. So your breathing should be even, and you take 2 readings, 1 minute apart. And it's the second reading that usually is more important. And it is best, I know it is very hard, it is best to ignore while to look at the numbers, because if you keep looking at the numbers, you get tense And if you're tense, of course, it makes sense, isn't it? Get tight થઈ જાય and the arteries tight થઈ જાય, the reading is going to change. Blood pressure is so labile and so responsive to our mood, our stress, our muscles, what we are doing. Okay, it is going to change at various circumstances. I'll touch base that in a minute. I'm going to show you how you take the blood pressure. So sit like that, absolutely relaxed arm on something that holds, so you don't have to hold it yourself in any position, and tie the blood pressure cuff. So I'm going to demonstrate. So now I'm going to show you how to take your own blood pressure at home. And this is very important because you'll be doing it on your own. The best time to do it is early morning when you're nicely relaxed. So before you start taking blood pressure, try to have few deep breaths in and out and really relax. Don't twist your legs, straighten them, and make sure that you are sitting really comfortable. If possible, find a place where you can place your hand more or less in the line of your heart. So if you see where your heart is around that line, and keep your arm really relaxed and stretched. Put the blood pressure cuff. If you have a look at the blood pressure cuff and straighten it, the tube has to go down. So it looks something like this. You put it inside. It's easier to do it beforehand and put your arm in. The cuff, the tube has to face downwards. And can you see the little arrow at the end of the cuff, just around there? That has to be about 2 inches above the line. And if you think that there's an artery going here, so we want this arrow going about 2 inches above, slightly on the left, and hold it there and slightly tighten the cuff. Roll it round and just relax. And relax the elbow. Make sure the tubes are not tightened. So you relax and you start it with the other hand. All along, make sure you take deep breath in and relax. And don't look constantly at the numbers, because the numbers always worry us. Because whenever there are numbers, you think, oh, is it going up? Is it going down? So try to relax your mind and think of nothing else. Deep breath in, blow, open your mouth and breathe out. Okay, so that's the first part of it. So when you have the blood pressure machine put on, you'll feel really, really tight, and that's it will get very tight and then it will release, but don't get tense and wait for it to release the pressure itself. Okay, so it will start showing the numbers, but make sure that you still remain relaxed. Take deep breath in, open your mouth and breathe out. That way you will get more relaxation and you'll be a bit more conscious about breathing. We are used to meditation. It's a lot easier. So try to go in meditation more, then you get the best blood pressure. And really relax. Make sure the legs, arms are relaxed. I will talk a little bit about the machine. It hardly takes 30 seconds. The blood pressure, as you can see, shows two numbers. The 120 or 76 and the pulse is 52. Absolutely perfect blood pressure. But don't take the first reading. So wait for about a minute and take another reading. So switch off. You make a note of this. A lot of machines have got memories as well, so you can have it in the memory. But after about a minute, you do it again. Same thing. 2 long breaths, relax, and then blood pressure karvanu. So usually second reading is a lot more relaxed. As I explained to you, take deep breath in, open your mouth and breathe out. That way you relax a bit more. And then blood pressure level. But the second reading, you write it down on a piece of paper. And it's important to do readings like this twice a day at around the same time. It doesn't have to be on the dot, but say first thing in the morning after you've woken up and you're relaxed, and in the evening, either before or after meal, doesn't matter, and it hardly takes few seconds. So again, if you see the second reading is 125/70, so very similar to what we got first. Pulse is 52, indicating slightly more relaxed status. So that's the way to do the blood pressure. Thank you. So this was Tejas, my son. Thank you for volunteering. If he's listening, I'm sure he's not listening. Chene, both my children are now very used to being subject of various teaching that I've done. Nana Tatyati, children development and everything. They have faced it, poor children. But so they're quite used to, and I got hold of Tejas today to do it. So thank you, Tejas. Now coming back, so we did how to take it and what machines. Make sure that they are approved and they are tested. So try to get a standard brand like Omron, AND. It's not M, but it's N, AND. And if you have chance to go to surgery, take your machine with you, because then in surgery, we have them calibrated all the time. So then it would be easy for you to take your machine and compare it with the surgery readings to say, okay, maru machine barabar chene. As long as it's within, say, a few millimeters, then it doesn't matter, because the blood pressure changes, as I said, with various states that you are. Just very fact that you are in surgery in front of doctor or nurse or healthcare assistant, you are going to be a little bit more tense. But always take your machine and get it checked at least once a year. That way you would have a good idea about whether it is okay or not, because it's very important. It does not go more than 10 millimeters out of sync. You need to keep a 7-day diary of twice a day, and it has to be around same time of the day. It doesn't have to be on the dot. Per morning, when you're nicely relaxed, and that's the best time. And keep 7-day diary and take an average reading. And I was talking about there was pulse reading on it. So this pulse reading is very important as well. So you check. Reading 72, 76, that's the pulse reading. So we want to just make sure, okay, that is noted as well. And keep your little fingers on your pulse to see a regular feel thai checking. Jo regular feel thai, so that's fine. If it is irregular, and 1 minute sudhi karvanu, just underneath the thumb, you feel the pulse with 3 fingers. And thodu irregular feel tha 1 minute ma more than 3 ke 4 beats juda ave. So then please go and see your GP and get it checked. So irregular heart rate no check up thai shake. So very important. Sorry, I'm just going to. Oops. Okay, we are here. So sometimes blood pressure gives, or people think that they've given. Once they know that they've got high blood pressure, they can get no symptoms, as I mentioned, completely zero symptoms. Sometimes they complain of just a little bit of muzzy head or fuzzy head, some dizziness. Occasionally people get headache, but by the time they get headache, the blood pressure is pretty high, so we need to do something pretty quickly, really. Occasionally it can cause tiredness and fatigue, and they blame it on blood pressure, but usually this is not related to blood pressure. And people who are already known to have high blood pressure may have some side effects from the tablets. And worse for all, occasionally the blood pressure is diagnosed, as I alluded before, is either due to some secondary cause, like a stroke, a mini stroke, a heart attack, oh my God, my high blood pressure, which is a situation we are trying to avoid today. However, I'm going to show you another video. This is a friend of mine called Saroj Ben Vasant, and out of blue we were talking about, and she told me what happened to her just a few weeks ago. She's very well now, but I'll let her tell you in her own words how her presentation was. So I'm going to play this video. Good morning, Saroj Ben. Good morning, Deepika Ben. Saroj Ben, તમે મને વાત કરી કે તમે હમણાં હોસ્પિટલમાં ગયા હતા અને તમને હાઈ બ્લડ પ્રેશર ડાયગ્નોઝ થયું છો. મારા મેમ્બર્સ માટે જરા કહેશો કે શું થયું?
માર્ચ મહિનામાં સવારના પોરમાં 5 વાગે મને બાથરૂમમાં જવું હતું, પણ મારા લેફ્ટ આર્મ અને લેફ્ટ ફૂટ બરાબર નહોતો. મારી દીકરીને બોલાવી કે મને હેલ્પ કરે લઈ જવા, ત્યારે ખબર પડી કે મારી તબિયત સારી નથી. અને પછી હું હોસ્પિટલમાં ગઈ. ત્યાં આગળ એ લોકોએ સ્કેન કર્યું, ઇસીજી કર્યું, એમઆરઆઈ કર્યું. કારણ કે કોવિડ હતું એટલે તરત જ લોકજીત હોસ્પિટલમાં 4 કલાકમાં મને ફૂલ ચેકઅપ કર્યું અને એ લોકોએ મને ડાયગ્નોઝ કર્યું કે મને હાઈ બ્લડ પ્રેશરને લીધે મિની સ્ટ્રોક આવી ગયો છે. અને મને એ લોકોએ તરત જ ફાર્મસીએ દવા આપી, બ્લડ પ્રેશરની અને કોલેસ્ટ્રોલની અને બ્લડ થિનિંગની. અને મહિના દિવસમાં મને એકદમ સારું થઈ ગયું. ત્યારે જ્યારે હું બીમાર પડી ત્યારે મારો ડાબો હાથ અને ડાબો પગ કામ નહોતા કરતા. મારો હાથ ઊંચો થતો જ નહોતો. પણ ભગવાનની કૃપાથી મને એકદમ સારું થઈ ગયું છે ત્યારે.
ઓકે. અને આ પહેલા તમને કોઈ જાતની કાંઈ બીમારી નથી, તમને પેરાસિટામોલ લેવી નથી ગમતી, એવું તમે કહેતા હતા?
મેં મારી જિંદગીમાં મારી નાની દીકરી 42 વર્ષની છે ત્યારે હું હોસ્પિટલમાં ગઈ હતી. ત્યાર પછી હું મારા જીપી પાસે પણ નથી ગઈ કે મને સારું નથી, અને કોઈ જાતની દવા પણ નહોતી લેતી. હું આ પહેલું વખત હું એકદમ બીમાર પડી ગઈ અને મારું બ્લડ પ્રેશર બહુ હાઈ રહેતું હતું આખો મહિનો, પણ અત્યારે ભગવાનની દયાથી બધું જ સારું છે.
અને આ તમને ઇન્સિડન્ટ થયો એ પહેલા કોઈ જાતના સિમ્પટમ્સ એ નહોતા? તમને કોઈ દિવસ ચેસ્ટ પેઇન થયું હોય, હેડેક થયું હોય કે કાંઈ? સોરી, આંખની પ્રોબ્લેમ કાંઈ નહોતું તમને?
ના, કોઈ જાતનું કોઈ પણ એવી સાઇન નહોતી કે મારી તબિયત નથી બરાબર. આ ઓચિંતાનું જ સવારના પોરમાં ઉઠી ત્યારે ખ્યાલ આવ્યો કે આટલું બ્લડ પ્રેશર હાઈ છે.
અને તમને કાંઈ આખો દિવસ તમે બિઝી હો, ફૂલ ટાઈમ જોબ અને વેરી એક્ટિવ લાઈફ?
યસ, હું કન્વીનિયન્સ સ્ટોર વર્ષોથી ચલાવું છું અને હું વર્કોલિક છું. મને કામ કરવું બહુ પસંદ લાગે છે અને મને આનંદ આવે છે શોપમાં જવાનો. પછી ઘરે આવીને ઘરનું પણ કામ કરું છું અને મને કોઈ જાતની સાઇન નહોતી કે મને સારું નથી.
અને તમારી ફેમિલીમાં કોઈને કંઈ પ્રોબ્લેમ નહોતો?
ના, ફેમિલીમાં કોઈ જાતની બીમારી નહોતી.
એટલે આઉટ ઓફ બ્લુ એવું થયું.
હાજી.
અને હવે તમને હાઈ બ્લડ પ્રેશર છે, તમારે થોડું ધ્યાન રાખો છો ટેબ્લેટ્સ ને લાઈફસ્ટાઈલથી?
હા, મેં મારી લાઈફસ્ટાઈલ ચેન્જ કરી નાખી. મેં કામ ઓછું કરી નાખ્યું છે. હવે હું બહુ થોડાક કલાક જ શોપમાં કામ કરું છું અને સ્ટાફથી મેનેજ કરું છું.
અને યુ ફીલ વેલ ને કાંઈ અત્યારે વીકનેસ કે કાંઈ નથી?
ના, I'm 100% fine. I'm 100% fine.
Okay, so you can see how important it is to diagnose. Sarad was lucky. Okay, it was a mini stroke. Mini stroke, we call it as transient ischemic attack. At Lenanak clot, your brain. Nice thing is nowadays in hospitals, they would do very, very quick scans and have got drugs that can dissolve the clot very quickly. So she had that treatment. She came out very quickly. She monitored her tablets. And after getting some of the side effects, she put it up and has managed to come through without any signs and symptoms. And of course, she's going to do lifestyle changes, which we talk about, various people need to do in certain ways. It can present something like that. Now, one makes you think in Sarojben's case, would it have been preventable? Joey health check mate gyawot, kantenu blood pressure earlier diagnosed thiwot, so would we have been able to prevent this stroke coming on? And I can guarantee you, yes, that would be possible. And she probably wouldn't have gone through this fright. But touch wood, everything was okay. And it was something that she has treated and she's taking it very seriously. Other ways of measuring the blood pressure would be when you go to GP surgery, we are not terribly sure, we put on a monitor called 24-hour monitoring. So, monitor kare, there are some wires we stick on you and you keep the machine and do everything normally. So if you're going out doing things, going to work, you need to wear the machine. Wearing machine should be there whether you are asleep or awake, and you don't need to modify your actions of the day. And you monitor for 24 hours, go back to surgery, take the machine away, and they read. And the readings that come to us are for every hour or so, depending on how it is. And the machines are very, very sensitive. So if it gets one reading, which is not quite right, it would take again. And if you are cheating, some people don't like it. It's an unpleasant feeling when you are asleep at 2 o'clock and the machine goes off and wakes you up. So people switch it off. The machine recognizes that that's what has been done, and it will try to do it again and again. So if any of us have to go and do it, please don't switch it off and let the machine do its work. It is only for 24 hours and it is life-changing thing that is happening. So please put up with it would be my advice. Now, 24-hour monitoring is gold standard really, because as I said, the machines are very clever. They have got chip in it which would recognize that things are not going right, but they are very expensive. They need professionals to put on the machine, and they need very close contact with someone who puts it in. So in this COVID environment, we don't encourage it unless there is some major indication where we are not able to get either home monitoring done or not be able to get reading and there is urgency of treatment. So about elderly both problem if they've got heart problems or the pulse is not quite right, then we would put the monitors on, but we really discourage them. Some of the pharmacies have started giving these services, and so it is always worth asking your chemist whether they have this facility. And it is best to be aware of all the secondary event, like weakness, or like Sarojben had weakness of left-sided arm and leg. She probably did not have the speech problem, but otherwise people can get slurring of speech as well at the same time. The earlier it's diagnosed, the better. People present with heart attack or shortness of breath. So be aware of those symptoms as well. Sometimes people just get this puffiness of the face. So there'll be bags around the eyes, not like mine. Probably lifestyle no છે પણ otherwise people can get bags around the eyes, and it's really fluid filled because body, as I explained to you, does not circulate enough and the kidney is not coping. So it's best to get to this before anything like this happens. So now say that you have got blood pressure, then what? Someone has got slightly higher blood pressure, and now there's nothing like slightly higher. So ideally we are aiming, and number wise it is less than 140/90. Okay, for a normal adult it should be less than 140/90, but if they have got secondary thing like diabetes or something, it should be even lower. It should be 135/85. And there are various stages. So someone who has, let's take someone who has no problems in life, like someone like Sarojban, fit and well, kain bijo problem nathi, active lifestyle, non-smoker, alcohol nai, doradori karta hoy, kain symptoms nathi, tenu sata we consider them various stages. So stages are, stage 1 is when it is less than 150/100. So enathi ocho hoy to we call it stage 1. And ena kata vadare hoy to it's stage 2, stage 3, stage 4, depending on the level it goes. And like Bharat Bhai alluded in the beginning is, okay, when someone has stage 1, okay, tamne blood pressure. So the people say when borderline, so there's nothing like borderline. Either you have it or you don't. There's nothing like borderline. So except, okay, you have high blood pressure. So don't call it borderline. But yes, you can do something about it. And yes, you can get rid of that level of I am hypertensive. And for that, lifestyle is the main course of action. Absolutely important to have these lifestyle changes. And I can't emphasize enough, can't give. It makes so much difference. And second thing is, if that doesn't work, and in a lot of people, there are not modifiable causes, so we give out medication, and there are various stages of medication. So some people, we start with 1 and then add 2nd, 3rd, 4th, 5th. You can have up to 5 medication stages, but take it very seriously. We doctors do monitor you very closely. We personally don't like to give you any medication. Medication આપીએ તો તમે આવે રાખો ને. એટલે don't think કે doctor પાસે ગયા ને એ આપી દેશે medication. They would only give you if it is necessary. So take it very seriously. If you're given, then there's a reason. If you have any queries, please ask them, but try and stick to the target blood pressure. At the end of the day, તમને ને અમને સેમ વસ્તુ જોઈએ કે તમારા બ્લડ પ્રેશર એકદમ નોર્મલ રહે અને ઓલા બધા કોમ્પ્લિકેશન્સ આપણે વિચાર કર્યા એમાંથી એકે ના આવે. Yes, so that's what we want to do. So what are the lifestyle changes? Like we need to look like Hrithik Roshan, I think. And these lifestyle changes can help to prevent and lower the blood pressure. And you can get rid of it up to a certain extent. So first thing you can do is reduce the amount of salt that we eat and have generally very healthy diets. So low salt, low fat diet is best. And then, I don't know whether you had chance of, some of you had chance of hearing me talk about diabetes. So MI low fat was prominent in my talk. Here again, low fat, low salt, because remember I said arteries get thickened and arteries have got lining of the cholesterol and lipids line up and they form plaques. Plaques is like scales. Pipe scales or in every the scales. And our scale, when they detach, that's what forms the clot. Now, if that clot goes in the heart, it gives heart attack. If it goes in the brain, it gives stroke. So our whole aim is, okay, I'll do everything for the blood pressure, but I'll also look after my arteries and reduce this plaque formation from the lipids. And so we would reduce the salt, એટલે fluid retention ઓછું થાય તો કિડનીને ઓછું વર્ક કરવું પડે અને જો કિડનીને હેલ્પ કરીએ તો it is going to produce these enzymes which will help you to lower the blood pressure, એટલે heart will get better. And that's the reason behind the salt. Without going into technical hormones. This is the layman's little explanation. And cut back on alcohol. Alcohol retains everything. It increases your levels of sugar. It increases the pressure on the arteries, and it causes liver damage, which can in turn cause you problems with other enzymes, which would put pressure on the blood pressure. So better to reduce the alcohol, and it helps weight reduction. Lose weight if someone is overweight, exercise regularly. Even little bit of exercise, like stand instead of sitting down, move about. So every kalak થઈ ગયું તો okay, આ series જોઈએ છે. So nowadays we could just pause it and go and do. If it is Hindi film or something, just pause it and go and have a little walk. So be aware and don't sit more than maximum, I would say 60 minutes, but 90 minutes is too much. You can't sit more than that. If થોડોક આંટો મારો રસોડામાં જઈને પાણી પી લ્યો, થોડુંક આંટો મારો પછી come back, but be aware. અને બધાને યાદ થોડુંક move કરે તો joints gets better as well. Joints get supple, it's better too. And if you can stand, it's better. People like Hrithik Roshan are always fidgety, and unlike even if he's giving interview, if you see, he's always moving, and I think that's how they get their calories down. And cut down on caffeine. Caffeine is again something that increases the hormones, so about 4 to 5 cups a day maximum. We're talking about tea and coffee. Sorry, Tejas has just come. And એટલે કોઈ સાંભળતું નથી મારી વાત, so he's probably not seen his video. And if someone is smoking, they need to stop smoking. I want to touch base again on salt, because out of all these, most of them are general, and I'm sure people understand that, but it's a salt that really affects the blood pressure, because kidney is so much dependent on clarification of the salt. And like I mentioned, little bit about medication, about 10 people in 100 do get side effects. So if you get side effects from medication, please talk to your doctor. Nowadays, we do have telephone conversations with the patients. So if you're getting any side effects like fatigue or dizziness or things, then talk to your doctors, because they would advise you various things, either change the timings of tablets or change the tablet itself or monitor you, or find something that suits you, because not one tablet suits everyone and every body. It is dependent on how people's kidneys and liver and body in general reacts. So do talk to doctors. Just because they've given one, you can't argue eunathi. So be open and honest with your GPs and tell them. And remember, no symptoms does not mean no medication. So once you're started on medication, the aim is to bring the blood pressure lower than 140/90. Okay, in ના થાય ત્યાં સુધી કઈ અડધો ડોઝ લેવાનો અર્થ નથી કે એમ કે આજે લઉં કાલે ના લઉં, આજે મારે બહાર જવું છે તો હું નહીં લઉં 2 દિવસ, એવું બધું ના ચાલે. You need to have a level which is constant. કારણ કે જો blood pressure અહીંયા ફરતો હોય પછી suddenly shoot up થાય તો that's the time when you're more likely to get that event, કે ઓલું clot કે કાંઈ હોય તો એ dislodge થઈ જાય કે high થઈ ગયું એટલા માટે. એટલે try not to have gaps when you're taking tablets, and you need to stick to the regime that is given to you. But if it doesn't suit you, please talk about it. So no symptoms does not mean no medication. You still need to carry on. એવું ના થવું જોઈએ, મને fuzzy head હતું, મેં અઠવાડિયું લીધું, હવે મને સારું છે તો I'll stop it. That shouldn't happen. You need to carry on till the blood pressure remains stable. And your doctor will decide if you need to come off it. If you've done very good lifestyle changes, but like you, stress is gone, your lifestyle is totally different, then by all means, we want to get you off the tablets, and that's perfectly a reasonable thing to do. So discuss if you've got any concerns. Also, regular monitoring, regular monitoring of the blood pressure, like I mentioned, and regular monitoring, which we can do at home. So till the blood pressure is really controlled and stable થઈ જાય, and a stable reading આવે ત્યાં સુધી it is essential to monitor at least once a month or every 1 week or every 2 weeks, depending on what and how fluctuant it is. But once it's stable, you don't need to keep taking your blood pressure every day. You have to accept that your blood pressure is fine, and unless something has changed, you don't need to. But till it is stabilized, as I explained, everyone reacts in a different way. Some may need this much tablet, some may need that much tablet, or some may need 5. So you have to be patient till your blood pressure in your system is stabilized according to the blood pressure, the blood test, your arteries, everything is properly maintained with the tablets without the side effects. So be patient and have stable blood pressure. Once a correct blood pressure is reached, you need to monitor only every 12 months. You don't need to keep taking care. આજે તો મને બહુ ગુસ્સો આવ્યો એટલે લાવું blood pressure check કરું, because ગુસ્સો આવ્યો અને blood pressure high ગયું, that is normal. So the lifestyle change is don't do gusso. That's the easiest thing, easily said than that. મને બહુ જ આવે. And there are some do's and don'ts that we have is do always measure blood pressure when you're relaxed. As I said, gusto auto, you haven't eaten or you are really worked up, come from home and out tune, people have annoyed or transport and karma and this and that traffic, and you come back and measure your blood pressure, it is bound to be high because that's the function of the heart, to give your brain more blood, and it is going to be high. So you need to be relaxed. Always measure when you relax. Keep a record of your blood pressure. So if it is steadily going up, then we can do something about it. And you don't need to measure it very frequently or every day. And always take at least a couple of readings so that you get into this relaxed mode when you can. And like I mentioned, don't measure when you're stressed or after heavy meal. Of course, heart is trying to pump harder to make the blood reach to our digestive organs. So your blood pressure will be a little bit high. After exercise, again, exercise means that your muscles and your ligaments and everything needs more blood supply. So the heart is going to pump faster and harder. So the blood pressure would be higher. And when getting angry, I have already said, so when events of the life just annoy you, traffic now and then, like I measure, and don't give too much importance to one of high readings at like, oh, Maruta 170 થઈ ગયું. But 170, we call it physiological. So it only counts if you're relaxed and you are in that mode. Anytime you're not sure, then do the 5 days or 7 days of twice a day and take an average. That would be the best thing. And it does not impinge on the treatment you receive. So if we can prevent and modify, and if we take all these measures, we'll be dancing like them and getting good exercise. Of course, the lifestyle, like Dayaben, I've forgotten his name. So coming back to, like I said, I would come back to salt. How much salt? And you can see this man is just giving a pinch of salt. So what is adult's dose? It is 6 grams of salt a day an adult should do, which is only a small teaspoonful. And this salt is not necessarily a separate salt. It is all in our diet. Whatever takeaway we got, whatever bread we make or we buy or sandwiches or whatever, it is not just additional salt, it is total content of salt. So really, really affects how we respond. So very, very important. So adults is 6 grams, which is about 1 teaspoonful. But children are even less. So from 1 to 3 years, it's only 2 grams. So just tiny bit. So it's better not to put anything more. And on the contrary, salty ખાવાનું હોય, it's best to take their food out. Babies should not have any salty one at all, is the guidance. 4 to 6 year old, they can have a little bit more, 3 grams એટલે આપણા જેવું જમે, પણ any additional nahi levanu જરાય. 7 to 10 years, little bit more, and from 11 years, it is adult dose. So salt amount is very, very important to monitor and eat less, really. Now, I wanted to touch base, and a lot of people may have questions about various types of salt. You know, we have rock salt, and we have Himalayan salt, and we have ordinary salt, and we have granule salt. All these are just salt. And the content of sodium in all these is similar. When you have any of these fancy marketing salt, all you get is added other ingredients. So you would get magnesium, you would get potassium, you would get various other measured or unmeasured elements, and they are not necessarily good for you. So you would be spending 5 times as much money on all this fancy salt because they are healthy and fatty, but the effect of sodium and high blood pressure will not change. So I would advise you that just because it is pink or black or rock or this or that, do not increase the amount. The amount should stay same. If you feel fancy and you think, fine, you have that, but as long as you stick to your 6 gram. Evidence shows that these type of salts have added other bits which probably have very little or none health benefits, really. So if there is magnesium or potassium or something, it may do something else to the body. That's about the only claim that they have, or justified claim towards the health. But it does not mean that it's good for you and you should eat more. So not to be tempted by all these. Now, there is some products which have got really high hidden salt. I call them hidden salt. And they are like bread products such as crumpets or bagels or ciabatta. They all have very high salt content. એટલે જ આપણને મજા આવે કારણ કે એટલું બધું salt. And salt is very addictive. એક વખત લેવાનું શરૂ થાય તો you want it more and more because salt kills off lot of other flavors. So કઈ તીખું લાગે તો ઉપર salt વધારે નાખે તો તીખું ઓછું લાગે. So you enjoy it more, or ખાટું હોય તો પછી એમાં salt નાખે to get the khatash down. But these are all bad things, really. So some of the food have got hidden and very high salt content. So we need to be aware and count them in our daily requirement. 6 grams. So it's always good to read the label and see how much salt is, especially if someone is already diagnosed with high blood pressure, are on tablets, then they need to look at green, yellow, red label. So it's best to avoid, especially the red ones. Pasta sauces have very high salt. The only reason we eat them is probably for salt. Pizza, to make it very tasty, they put lots of salt. Lot of ready meals have got salt, which is very high in content. Same with soups, vegetable soups, they have very high content. Sandwiches, they make specifically quite high content in salt, to make them taste better. So they add either in the bread or in the ingredient. Same with sausages, whether they are those corn or vegetarian alternative, they do have very high salt content, so be very careful about them. Tomato ketchup, surprisingly, has got very high. Same with mayonnaise and other sauces. Peri-peri, salt. So be aware. Nobody's saying you don't have to eat. You can still eat them, but count it in your daily allowance, and make sure you don't eat anything extra and be aware and have in moderation. Breakfast cereals, some of them have got very high, and it's usually yellow to red that it shows salts. And I was surprised when some of the cornflakes had very high content. So it's best to check it out, especially these ready-made products. And some ingredients that we are now, I know I've put this lady who is really shouting, but I think we can just be reasonable about it. And so if you're using cheese or gravy granules, olives are of course salty, as we know. Pickles, apra pickles are really high in salt content because salt is a preservative. Salted or dry roasted peanuts have got very high content. So if you can get away and have just salt less, then that's very good. Soy sauce is nothing but salt, very high. Stock cubes, yeast extracts, they all have very high. So that's pretty high. Although it gives you vitamin B12, they are very high in salt content. Now I wanted to touch base a little bit about alcohol. How much? Especially during lockdown, and एक बे bottle per week, मतलब बहुनत पीती बेच bottle per week पियो. That is way above. So you need to have 14 units for women on men per week, not more than that. So that one bottle of red, white, or rosé has 10 units. So you can imagine 2 bottles will be too much per week. We're talking about 20 units. Stress can increase the blood pressure, like we discussed, and it's better not to have the fluctuations. So try to reduce the stress. Like Saroj Ben was saying, she reduced her hours at work. Her modification was that because there wasn't much else she could do in her lifestyle. So that's what she's done. So stress and reducing the stress and being aware you are getting stressed, and that will keep your blood pressure high and high, can have a lot of effect on it. Exercise and weight management, we discussed. We need to get rid of it. Now, I want to show you a little recipe that my friend Parul had made for us. And she very frequently, Parul is a very clever girl who makes these lovely snacks for everyone. And she brings them, and I will show you what she had done. And I love her, this little recipe that she had done. So let's have a little look. It will give my throat a break as well.
Hi friends, I'm going to make a dish which is high in protein and low in salt. The ingredients are 1 cup of sprouted moong, half a teaspoon of jiru, 1/4 teaspoon of turmeric, 1/4 teaspoon of red chili powder, 1/4 teaspoon of salt, 3 cloves of garlic finely chopped, and 1 whole red chili. Okay, pause. And put in half a teaspoon of olive oil. Wait till the olive oil is hot. Put in the red chili. Cook it for a while. Next, put in the jiru. Wait till it's cooked a bit as well. Once the jiru is slightly cooked, put in the chopped garlic. Once the garlic is slightly cooked, put in the turmeric. Cook it well. And then add the rest of the ingredients. Mix well. Add a couple of tablespoons of water and reduce the heat. Cover it and let it cook for 10 minutes at a low heat. Start. After 10 minutes, this is what it'll look like. It's ready. Take it out in a serving bowl and garnish it with coriander.
Lovely. Thank you, Parul, for providing that. It is very nice. Sounds delicious. Thank you. That brings me to end of my talk. So to summarize a little bit, I just want to bring it back to home that blood pressure, having high blood pressure, does not necessarily mean that you would have tablets for life. But should your blood pressure be not controlled with lifestyle, then it is better to continue with the tablets. It is very important to diagnose early, and the only way we are going to know is if you go for screening. Either you measure it yourself or you get it measured from various places. But it's very, very important to have it measured. After 40, it is important to measure your blood pressure at least every 5 years, if not yearly. But keep an eye on your lifestyle. And earlier we put the lifestyle measure, the earlier we can prevent any complications. High blood pressure is something you would not have any symptoms, so you need to keep it in forefront and take on the NHS health checks if possible. Thank you for listening, everyone. Any questions?
Thank you so much, Dr. Dipikaben. I'm just gonna, if you stop showing the presentation, I believe Sandhya-ben and Rajal-ben are gonna put forward the questions.
Okay, I'll just take it off.
Thank you. That's very informative. Thank you. Okay, great. Thank you for that.
I'm back.
So I'm going to hand over to Sandhya-ben and Rajal-ben.
Good afternoon. Are you? Can you hear me?
Okay, excellent presentation, Dipikaben. Well done. Very good, very informative. We have lots of questions lined up on this chat line and on Facebook. So I have picked up all what I could from our Zoom chat.
Okay.
Okay, the first question is, does it matter which arm? It's a simple one, but I'm sure we need an answer. Does it matter which arm you have to do the BP?
Yes, it does, in fact. So initially, it is better to check in both arms. There is a condition called coarctation of aorta, where two arms can have different blood pressures. So when you check it first time, try to check it on both sides. Otherwise, the closer, if they both are similar or same, then it doesn't matter. If the difference is more than 20 millimeters, the bigger reading, then you must check it again and go and see your doctor, because that would mean that one of the arteries is kinked. And sometimes we are born with it. So your blood pressure in two arms may be different. And if it is different, then we need to investigate as to why. But otherwise, measuring from one arm or the other doesn't matter. You can measure on the nearest one, which is to the table and where you can relax most and you can keep your arm comfortably. At surgery matomaru side like this, sit on this side. So I usually measure on right side. On some of the rooms, I have left side because that's where the table is. But what's important is that patients have straight arm and relaxed. But it should be straight and nicely relaxed.
Excellent, thank you. I'll let Raju do the second one from the Facebook, and then I'll take over.
Jai Shri Krishna, Deepika Ben, thank you so much. You know what, it was so informative, and I'm gonna stop eating salt, full stop. You know, there you go. I've made my mind up. You know, thank you so much.
I'm so sorry, but I'm frightened not to go. But I think our diet ma vadhare hoy chhe thodu. Apne gathia khai ke aloo dhokra khai ke whatever. Everything is so salty, isn't it? And when we buy them, you'd notice ke they do make them more and more salty. Pachi eની સાથે ચટણી લઈએ તો એમાંય salt હોય. But તીખું લાગે એટલે મરચું લઈને એના ઉપર salt નાખે. So the total content really goes up, and our poor kidneys have to function more. So be aware. I think that's my message.
No. So the first questions come from Facebook. Is blood pressure hereditary, and how can it be treated?
Yes, blood pressure can be hereditary. Like we said, that some people have got family where the arteries are very tight. A lot of Afro-Caribbean population has that. Some of the Indian families or South Asian families have that too. And the blood pressure is higher. And if you have got family history of blood pressure, it is all the more important that you keep an eye on your blood pressure. So when I was talking about essential and secondary, so primary and secondary, the essential blood pressure is something that you just born with. It just happens, and whatever your lifestyle or things, and you're more likely to get it at a younger age as well. So if there's a family history, be aware of it, and from time to time check your blood pressure, but at least by the time you're 40. But if, say, there is a family history that you have got some of the relatives who may have blood pressure in 30s, and if we investigate completely, they haven't got any kidney problems, they haven't got any tumors, nothing, but they still have high blood pressure, they are essential high blood pressures at a younger age. And if God forbid you fall in one of those, then get your blood pressure checked and treat it nice and early. The main crux would be lifestyle modification karo, to you're only going to be able to modify up to a certain extent. So very important that if you've got family history, then you keep an eye on your lifestyle, make sure it's ideal, and at the same time accept that if you've done everything, then you are going to have blood pressure, so accept the tablet, accept the medication. The aim is not anything but to reduce it nicely so that you don't get secondary complications, because anyone with family history is more likely to have complications because they would not realize they've got high blood pressure. And that's why it's silent killer. It's symptom and suddenly heart attack, because stroke was so annoying.
Yeah, no, thank you so much for that. Sandhya Faye, do you want to go with the next question?
Yes, thank you. Okay, Deepika Ben, this is a long one, but I'll read it slowly, okay? It's from Trishul, one of our audience. He is 37 and was diagnosed with essential hypertension at the age of 36. He senses that he may be on tablets for a long time. Now he's got two questions. Are there any long-term adverse implications of taking tablets? And the second question is, are there any tests available to reduce if hypertension is genetically driven? He's fit, like he's running 3 to 4 times in the week. He's healthy, he's not overweight, his diet is reasonable, he's vegetarian. Therefore, he senses a genetic disposition may be a factor in the equation.
Okay, very, very good. And that's what we alluded in the first, that you are unfortunately, Trishul, in one of those groups where there is hereditary. So if you have already been diagnosed at such a young age, that means I presume that they've done all the investigations and ruled out all the secondary causes before giving you the label of essential hypertension. That means it's a blood pressure that your body is having. It is just, that's how you're built. You know, like some people have asthma, some people have eczema, and that's how they are. So you have to accept, you can't keep fighting. So you do need to make sure that if your lifestyle is beautiful and you've done everything, so the sound of it, you're doing everything possible, that you will be on tablets and you will be on it for a long, long time. And that may mean life. But what is important is that your blood pressure constantly remains same, so that you don't have fluctuation where you give up tablets and you don't and you start ignoring it, because the earlier you're diagnosed, the more lifetime you have to cause the damage if the blood pressure remains high. But if you bring it down, then your risk remains same as others. Now, your question about would there be any implications of long-term medication? Yes, there are certain implications, and that's why every year your GP will monitor your kidney function. They will monitor your liver function, and it may be from time to time they'll either modify the tablets or increase or reduce the tablets. And along with it, they would also monitor your cholesterol and lipids levels, etc., to make sure that the overall risk of you having any secondary changes is minimum to none. So once you accept, I think the biggest thing is accepting, no, you cannot do anything about it because that's what you're born with. That's how your genes are. So you rightly predicted that genetically you have that, but that's okay because it has already been diagnosed and you can do something about it. So if your lifestyle is absolutely optimum, you have to accept that you are someone who's going to need tablets. It's like, you know, when children need some asthma preparations or something, we can't say, inhaler. They have to have inhaler because it makes them feel so much better. It doesn't mean that anything has changed. So long term, the more control you keep, the less chances of having secondary problems. It may be that some of the drugs may give you some more side effects than others, but we would be monitoring it very closely with 6 monthly or yearly blood checks of your kidneys, liver, your heart, etc., to make sure that there is no long-term damage. If the damage starts showing in spite of everything, we can do something about it. So to undo may not be possible, but you need to accept and you need to have the aim of optimum blood pressure.
Very well explained.
Have I got both your questions?
Yes, I'm sure Trishul has picked it up.
Yeah. Trishul, regarding your test available, so I hope, and I'm sure they would have done all the tests to rule out secondary cause. If secondary cause is ruled out, then you have essential hypertension, and that's how you are, and that's okay.
Brilliant. Thank you. I'll pass it on to Raju.
Okay, so Deepika, it's a very common question, and I've seen quite a few of these coming up, and I know you've addressed this already in your first couple of slides, the causes and symptoms of low blood pressure. But if you can just reiterate it once again for those who've joined us slightly later on, and just a brief overview, if you could, it would really be appreciated, ma'am.
Okay, so causes of high blood pressure. You mean high blood pressure, low blood pressure?
Yeah. They've just said low blood pressure. Sorry, yeah.
Okay, low blood pressure is completely different. So there is essentially not very many people who have inherent low blood pressure. So low blood pressure is always due to something. So it may be that you have, I shouldn't say this after all this, low salt. Hyponatremia can cause low blood pressure. Low blood pressure in general, I don't know whether there is any definition. So if someone is very ill, they would have low blood pressure. If someone is on some drugs, they would have low blood pressure. If someone has been unwell in any way and have lost fluid, lost a lot of fluid, then they can have low blood pressure. But low blood pressure is not something that is a diagnosis. So in some elderly, and in some young, there is a genetic syndrome called hyperaldosteronism, or some tumors which cause this hormone, which make the arteries dilate, and that's why the blood pressure remains low, and we have to give something to bring the blood pressure up. Otherwise, as I said, all those secondary causes. Now in elderly, very elderly, there is a group of elderly who have no other cause, and each time they get up, they just fall down. And that's because their arteries have become so dilated, elasticity that has just gone. So instead of pumping the blood back to heart, it just keeps it. So blood does not reach the heart. So although the heart pumps to a certain extent, it just does not get enough blood back. So there will be low blood pressure. The Lohana and salt tablets here. After all that, I have to say that to you. They can have, but that is very rare. And it is in very slim people, elderly, very frail people that they can have low blood pressure. Otherwise, low blood pressure in normal people is fine. What is important is that you drink lots of water throughout the day, because fluid depletion can cause low blood pressure. So you must not be fluid depletion anywhere. Even thandi mai, breathe we lose some fluid. So it's very important that you have 1.5 liters of fluid a day. So we're talking about 5 to 6 cups of 200 mils, really. It could a minimum fluid jauge. I'm not saying it has to be just water. It can be juice or your chai or coffee, not more than 3 to 4 cups of chai, maximum 5. Have lots of fluid. So if you're feeling blood pressure low or disease, to drink water, and that will bring it up. Don't go and add something, because low blood pressure as a diagnosis is a pretty serious thing, and we would like to check it out in normal people.
Okay, great. I like the fact you said drink fluids. Does that include alcohol as well? I hope it does.
Yes, within reason. As I said, 14 units a week, not more.
I'm sure a lot of people, gentlemen on the group, will be very happy to hear that.
Not more than 14 units.
That's fine.
Can I mention in alcohol? I said 14 units, right? But it is better to stagger it over 3 or 4 days a week. It is best not to have binge, and it is best to have alcohol-free days. At least 2 to 3 days a week, you should have alcohol-free. So even if you're having, say, a glass of wine every day, then don't have at least 3 to 4 days when you don't have any alcohol at all. Please, please. Whether it's beer or your wine or your gin and tonic, whatever it is, just be aware of that. But yes, that counts under fluid, and that's okay. I'm culprit of that too.
No, fantastic. No, thank you so much. I'll make sure I'll hide that bottle of wine straight away.
Hydrated, not more for you, not more than 1 bottle a week.
Oh, I thought you meant a day. Sorry, I mistook that. My apologies. I'll pass it on to Sandhya Fay before I get told off.
Otherwise, I'll have to come and do your liver function test or talk about liver here next.
Okay. I believe Facebook questions have finished. So what I'll do, Deepika Ben, I've got lots of questions and we got only half an hour. So we'll just Zoom, we'll just go fast, okay?
Yeah.
So are smartwatch BP readings reliable?
Sorry, can you repeat it?
Are smartwatch BP readings reliable?
No, they're not. They're not, because it depends on where it is kept and what you're doing and how much is the pressure. So every machine has different. So smartwatch gives you an idea, but it's best to buy that machine that I mentioned.
Sure. Indiraben, I hope you heard that answer. Okay, I suffer from low pressure. This is from Vinaben Wakani. I suffer from low pressure and doctors can't do anything about it. They told her not to increase salt, but putting salt in the juice only makes her feel better. Otherwise, she feels dizzy. Any suggestions?
Yes, because what is your low blood pressure? How much is a low? What you consider low may not be low at all. You may think it's low blood pressure, but what is low? Because the lower you have, the less chances of having heart attack, the less chances of you having those clots dislodged from the arteries, and less chances of your kidney or heart suffering, less chances of you getting glaucoma. So there's nothing like low blood pressure unless it is so low that your electrolytes in the body, your sodium things are low. You should not add salt really. Try drinking water by itself and you will feel better. The reason you're feeling better when you add this in the juice, salt in the juice and have it, is because you're getting all that fluid. I don't think it is salt that's making much difference. So I think you should try and see. But if your blood test, your kidney test is completely normal and your blood pressure is, I don't know what you call it, low, but say it's about 100 over 60 or something, that's not low. I run around with 100 over 58 or something. I don't, it depends on what it is. So if you're not on any tablets and your blood pressure remains stable, then that's good. It's good to have low than high. So there's no diagnosis low blood pressure, as I said. Either there is kidney problem, heart problem, or you're very ill, or drugs, or very elderly. Those are the only circumstances where you need treatment. Otherwise, people walking about usually don't have any symptoms. If you need those salt tablets, then it's best to get your kidneys checked and your level of sodium checked before you start adding salt. You try drinking water and see how you feel, or just juice or whatever you like.
Thank you. Thank you. Vinaben, I hope you are still online. Okay, question number 5. Should one take BP before or after a meal, or drink like coffee or tea? Should one take blood pressure before or after a meal, or drink?
So like I explained, the best time to take blood pressure is before meal. After heavy meal, your blood pressure tends to be higher because obviously the heart works harder to get the blood pressure everywhere. So first thing in the morning is the best time. So once you had your tea, coffee, or before that, when you're relaxed, what is important is whenever you take 2 readings and you're very relaxed. Try not to take it after exercise, after heavy meal, or when you're getting angry at someone, or you're shouting, or one of the life events is making you very cross. That's when your blood pressure goes up, and it is like a fright reaction. So if you see a tiger, your blood pressure will be really sky high because your body needs to be alert and run away. So it is a normal reaction when you're angry or frightened or stressed or something, blood pressure will be high. Best time is in the morning when you're very relaxed, or in the evening when you're relaxed, not immediately after meal, and not when you're very, very hungry and tired.
Okay, she also says that she read somewhere that coffee is relaxing and lowers blood pressure in some people. Is this
so there is evidence to show that 4 to 5 cups of coffee can be good for the heart. So that is the caffeine in the coffee. And they found out that the coffee manufacturers especially did a big research and advertised this, that taking coffee does help the heart. So if you like coffee, in moderation is good, whether you have coffee or tea, that's by the by, and you can have it. I don't think it has got any major positive effects, so we wouldn't give you coffee tablets, and I would discourage you from having something additive. But yes, if it's within your quota and you prefer coffee, then that's fine. There is evidence to show that it does help the heart.
Thank you, Deepika Ben. Now, another question. NHS health checks. Both his father, who is 89 years old, and he is 63, do not receive any letters or contact from the GP clinics. They have to request these checks, which are not usually obliged. Can you shed some light on this?
Yeah, I'm not sure, because GPs are contracted to do the NHS health checks. Now, some areas have got special units which go and do NHS checks. But remember, since last 2 years, we have been absolutely inundated with COVID and COVID-related illnesses and work, and our workload has really gone up. So all the routine work has been put on back burner, really. So NHS health check becomes less of a priority than people who are on waiting list for, say, serious illnesses, cancers, that sort of things. So I think GPs have been inundated. And again, NHS health checks and do need face-to-face appointments with the healthcare assistant. And with COVID, we were discouraging any face-to-face, which was not going to make major difference. So like I mentioned to you, you can get your blood pressure measured yourself, do 7-day and send them the reading via email or your e-consult, and they will be able to respond. If there's any doubt, they'll do a telephone consultation. But they don't necessarily want you to come to surgery and have all the tests. I would presume that's what the surgery is. Every surgery works in a different way. Every surgery has different resource and different demand. So I can't comment on individual practice, but in general, last 2 years, this is what has been with all of us, really very difficult times.
Thank you, Deepika Ben. Jai, I hope you've taken this message, this answer. Okay. Somebody has written, there's no name. So I'm in my early 50s and my blood pressure is normally about 150, 115. So 150, 115. I did have tablets for a while, but have been off them for a year now. My parents have hypertension, so it's probably genetic based. Should I be worried about this high value, or is this causing any damage to organs? If I've not been told, it's not necessary to take tablets or lower the BP by my GP?
The answer to both your questions is yes. You should be worried, and yes, it is high enough for you to take the tablets. So if you were on tablets, why were they stopped? Like I mentioned, the goal is to bring the blood pressure down to less than 140/90, and you need to act on it, especially if you've got family history, you're more likely. So by all means, do the lifestyle measure, but I don't know what has gone wrong and why your tablets have stopped. They should not have been stopped. So my advice to you would be, do the 7-day reading morning and evening, send it to your GP and say, this is the average, and why have the tablets not been given? Because you should be on it completely. I'm surprised they haven't called you for monitoring, and why they have stopped, I cannot tell you. But you should be on tablets and you should carry on, and the blood pressure should be 140/90. So if on tablets, say your blood pressure comes to 130/80 because you're on tablets, doesn't mean that you stop taking tablets. It's only brought it down to a good level because you're on tablets. So don't take the readings like that as that it has gone away, the problem has gone away, because blood pressure does not go away. And especially with your sort of history, you do need to act on it. So I would contact them, do a 7-day reading, so then all the toing and froing stops. They will give you the tablets and they'll call you for routine and they'll put you on the list. So we have long-term conditions list, and we would put a recall. So somewhere along the line you are dropped out, and you should not stop the tablets.
Thank you, Deepika.
Yeah.
Using different type of salt can make any difference? I think you covered that, but
I touched base on it. It's very
Yes.
common, and especially nowadays with the health fads that are going on. No, there is no difference at all. Your amount of salt still goes same. What you get is some added minerals depending on where it has come from. So the pink would be this Himalayan salt or rock salt, which is black, and things have got other things. So they would have iron or potassium or magnesium, things like that, which are not so pure, and we don't know what amount you're getting, but the amount of salt that you take remains same, and you should not take it more, and not one salt is any different than the other. Zilt.
Thank you. Okay, taking BP readings within 1 minute, wouldn't in many cases when people take their second reading, it's likely to be higher if their first reading was not within their expectation?
No, and that's why it's important to do the breathing and to make sure that you are relaxed. Now, if you are all tense, then leave it for a little while, and then do it again. Do it after 5 minutes, after 6 minutes. My experience is if you leave it for 5-6 minutes, people get fed up and don't want to. Who wants to sit there with blood pressure machine hanging on your arm for 5-6 minutes? You need to understand the mechanism of it. What is important is that you learn to relax. And the best way is to straighten your legs. So don't put one leg on other. Have really relaxed mindset and take deep breath in, open your mouth and breathe out that way, and concentrate on breathing instead of seeing the numbers, because numbers can vary. Like I showed you on Tejas, it was the first one was just 2 millimeters higher than the second one, and very similar. The pulse went from 56 to 52. So he did relax after a minute, although I had video on him and I was blabbering about and everything. So in general, that's what happens. But if it's making you tense, then leave it for a little while, but have conscious effort of relaxing. What is important is that you try and relax when it's done. Eventually you will become clever enough to get the reading. If the first one is normal, then it's normal. Why do you want to take second one is how I see. But initially, to get used to the whole process, it's better to do that.
Thank you. Thank you, Deepika. Is it okay? I think you covered this as well, but let them have the answer. Is it okay to have a little bit of red wine now and again to lower the risk of heart diseases?
No, that's perfectly all right. It's okay. It should be within your allowance of 14 units a week. And by all means, have a bottle a week, not a day.
Okay, is pink salt good?
I don't think it helps, but it's okay. I mean, there is evidence to show Mediterranean diet and red wine and things in Europe has helped, but there is no specific. People are putting, okay, their diet is olive oil, lots of salad and red wine and relaxed 2-hour meal in the afternoon, and all that is the combination of it. So people pick up what they want to. And I think wine is one of them. But as long as it's within moderation and in your allowance, by all means, go ahead and have your red wine. But have it 3 to 4 days without alcohol.
Sorry, I have 3 more questions, and then I can still read few online. So we don't have much time. So just if you can quickly just give us a brief answer, okay? Is it correct that the normal BP numbers of 140, 90 will be higher for a 60 or an 89-year-old due to being older?
There is evidence to show that systolic evidence is more, systolic blood pressure, the higher number is more important in elderly. So sometimes in elderly, we would leave it till 150, but it is better to have 140, 90 or lower in order to prevent the complications. But in elderly, we would make a little leeway up to 150. But there is another study which showed that if systolic is high, they are more likely to have stroke because all the other risk factors have increased. So in elderly, it's even more important to bring the blood pressure down, but they need to have less side effects.
Thank you. Is there a minimum amount of salt we need daily?
So 6 grams per day is what is the recommended daily amount. And that you would get in your day-to-day food if you don't add anything extra.
Thank you. What about our Indian first sons? Is high in salt?
Dreadful, very, very high in salt, very high. And the only reason we get addicted to those is because of the salt, I believe. It may be tikku as well, it may be the spiciness of it, but yeah, I mean, those first sons are just notorious. And if you reduce, plus it's all tarelu, isn't it? It's all fried. So that's the worst thing we can have. So try not to have gantias for breakfast every day. It's not very nice.
Okay.
Rotlo.
Okay.
Rotlo is very good.
Rotlo is very good, yes. Okay, thank you. Can you comment on cause and what can be done to reduce DIA reading? The second reading, what if that is high, but cis is normal? Size is normal.
Sorry, can you repeat the question?
Yeah. It's from Omni Takrar. Can you comment on cause and what can be done to reduce DIA reading?
Yeah. Diastolic reading. So diastolic reading is as important as systolic, and we would take it both, and that's why one number is no good. So I can't say 140 over 100 is okay. Diastolic is a lower number for everyone's understanding, and systolic is the higher one. So if we say 120, 80, 120 is systolic and 80 is diastolic. So what Avni Ben is asking is, that if it is the top one is 140 or 130, but the lower one is 100, it is still high blood pressure and it still needs to be treated. On the contrary, it means that, remember, the systolic is the heart and diastolic is, grossly speaking, is the backflow. Which the arteries. So that means there is already some problem there and needs to be treated pretty vigorously and investigated. Why has someone got diastolic high blood pressure?
Thank you, Deepika ma'am. Now, Jagdish Bhai writer, how long would you anticipate the medication taking effect?
Medicine takes effect very fast depending on the dose and the response that someone has. So we tend to start with a low dose, but if someone has very high, remember I mentioned or I briefly said that there are various levels. So if someone has level 4 or malignant hypertension, which is very, very high, we would give you blood pressure tablets, which will work within half an hour, within minutes, within 4 hours, that sort of things. But if it is, say, generally grade 1 or 2, where we can have time to bring it back in community, you would have maximum effects within 2 weeks. So be patient for 2 weeks. By 2 weeks, we would have done another blood test. We would have checked that there's no side effects, give you time to get adjusted, and then adjust the dose. If by 2 weeks it hasn't worked, then it is time to change the dose. Occasionally, there's too much fluctuation, and we say, okay, now stay on it for 4 weeks before we check it out. But by 2 weeks, they should have brought it down enough to decide whether you need increased dose or change or increase of the tablet.
Thank you, doctor. Thank you. Should we avoid adding all sorts of sodium, like adding to dokla and making them fluffy?
Yes, I think any sodium you shouldn't. So salt is different than the bicarb. Sodium bicarb is okay because you would only eat tiny bit, isn't it, to make it fluffy. You're not going to add a spoonful because it will taste horrible. So that doesn't matter. But don't add more salt in your dhoklas and your chutneys.
True. If you have high blood pressure, is there any cure or is there any herbal medicine which can cure high blood pressure?
I'm not expert in herbal medicine, but there, as I mentioned to you, there are two groups. One is that the high blood pressure is due to lifestyle, and that is very much modifiable, and you can bring it back to normal. And there is other group where there is genetic factors, and those are the ones which you cannot cure, but you need to accept that, yes, it is high blood pressure and you've done everything possible. But at the same time, don't just give in to it. Lifestyle remains absolutely first line in everyone, whether there is any cause or not. Lifestyle is a must.
Thank you so much. If I have cholesterol high like 6.4, any idea, please, how to take down?
Yes,
How to take it down?
very much so. So 6.4 cholesterol is just one reading. So in it is high density lipids and low density lipids. So you need to have those readings as well. In us, especially Gujaratis, we have high triglycerides, which is that instant fat, which is very, very bad for the heart. And it increases LDL, what we call as low density. And the less fat you have, the less the cholesterol. So if you cut down really, like in the recipe I showed, that Parul put only 1/4 of a spoonful of this olive oil to fry her onions and to do all these nice things she was doing to it, but only tiny bit of oil. So the less oil you put, the better. Tamare only sunflower ni ke hoy, ek bottle hoy. So you put a date and it should last you as long as you must. Because if you don't put date, then it's easy to pour. It tastes the better thing. Cream na kien, olu na kien, badu na kien, curry. So it's going to taste a bit better. But let go of taste a little bit and modify the fat content. If you can modify your fat content, have minimum. So tame butter chopro ke olivio ke whatever you put on your bread, put minimum. Just reduce fat everywhere, and your cholesterol automatically will come down nicely.
Thank you, Deepika Ben. Is 90/85 low blood pressure?
If you don't have symptoms, no. 85 is very good diastolic. So if you don't have symptoms, no, that's fine, but drink lots of water.
Okay. Right. It is important to do check before. Okay, Dinesh Pai, is it important to do check before taking BP tablets in the morning, or does it not matter?
It doesn't matter, no. Once the blood pressure is, sorry, you were talking and I interrupted.
It's okay. It's okay. Now, then I'll, then he says that also, if one is taking 10 mg tablet, would it not be better to take 2 5 mg tablets few hours apart in the day?
Okay, so 2 questions really. Do you need to take your blood pressure every day before taking tablets? No, because the blood pressure tablets are only established after making sure that your blood pressure is persistently high. That means you have hypertension. So it is established. So now all we are doing is monitoring. So it's not going to change whether you take tablets or not from the one-off reading that you get every time you take tablets. So you mustn't take it every day. Maximum you need it is once a month. But once it's established, as I said, we take it once a year. But you can take it every 6 months, and that's more than enough. And keep it nice, keep it low, and don't keep taking it every day. And your second question about whether to take 2 or 5 milligrams, little bit apart, or take the 10 milligrams all in one go, it makes no difference, because these 10 milligram tablets, I presume you're talking about the felodipine or amlodipine. Those are 24-hour working tablets. So it keeps your blood level of that drug up to a certain extent. Now, if you take 5 milligrams, it will go up. Then as it is going down, you take another tablet, so it will go up like that. So you don't want that. You take one and it lasts for 24 hours like that. And by end of 24 hours, it starts then reducing. But by that time, you will take another one. So no, if you are being told that it is once a day, there are some drugs which we do give twice a day, and they are something that is absorbed and stays, and after 12 hours it starts going down. So that's when you need another dose. But ordinarily, if it is once a day tablet, it lasts for 24 hours. It's best not to have that peak and trough to change the levels. It is better to just take once a day what's needed, and that's that. It does not change. If you take another one after 4 hours, you just mess about with the level.
Thank you. Thank you. Are there, I know you are not Ayurvedic, but let's answer this question. Are there any Ayurvedic ways to treat BP?
I am not qualified to advise you on Ayurvedic, so I'm afraid I can't answer you. There may be, all these tablets come from herbs of one sort or the other. They are chemicals, and if we look at the origin, they are derived from something or the other that is in the nature, and it has been purified. So I don't know whether there are Ayurvedic tablets. I'm sure it is a very established field, and I'm sure Ayurvedic specialists will tell you. But please monitor and don't just stop suddenly anything that is there.
Okay, thank you. Is there evidence to show that pink Himalayan salt is better than normal salt?
I think we touched base this. No,
Yes,
it
we
isn't.
did, but
Salt is salt. All you get in pink Himalayan salt is more minerals. And these minerals have its own effect. And the amount you get varies because it's not pure. So no, the amount of salt still remains same. And it is not better. It is exactly same as the other salt, as far as the salt is concerned. All that Himalayan salt has is extra chemicals.
Thank you, thank you. What about good fats like avocados, ghee, which you need for brain function without raising LDL?
Yeah, so the like we touch base that you have moderation, and it's better to have good fats than bad fats. So it's better to have your avocados and things. But again, like alcohol, there is so much fat that you must have. Just because it is good fat doesn't mean you have more. You have it within your daily requirements and not excessive.
Okay, we are coming to an end, like 2 more questions and then we'll come to an end, okay? Is there any cure for high blood pressure?
Lifestyle is the biggest thing. As I said, some people can modify lifestyle to the extent that it goes away, and that's fine. But some people are not so fortunate who may have either genetic cause or a secondary cause, and those are not curable at all. Sometimes the age itself gives them high blood pressure, and that's not curable.
Thank you. And finally, for once a day tablet, is it best to take at night or morning?
Okay, so there is evidence to show that the blood pressure taken in the morning is more remembered, and there is a routine that is more established. So that way, taking in the morning is good. But if someone, say, feels dizzy or nauseous, especially people, you know that incident I told about Sarojben, I'm sure she wouldn't mind me mentioning. I hope she is listening to me now. So one of the things she mentioned was she was getting severe side effects. She was feeling nauseous all day. She was feeling just not herself and little bit dizzy, and just wanted to give up tablets. Someone who's never had anything. And what I suggested was, why doesn't she try at night? So then when it starts its effect, the lowering of the blood pressure, then its digestion and absorption by the body organs, you are asleep, so you are less likely to get symptoms. And by morning, the level is okay, and you wake up and the blood pressure is controlled. And after a few times, all these tablets, if they give you side effects, don't stop at first go unless it's unbearable. Try to change it to nighttime, or try to just persevere for a few days. And if you have it for more than, say, 5 to 10 days, then you know that it is not your body getting used to. So no, the timing is important only in how quickly it works. So there is a drug called doxazosine or alpha blockers, which we say take at night, simply because it works so fastly. It brings the blood pressure down so quickly that people can feel bit, oh, I can't stand type of dizziness. So then we advise, okay, when you start, you take it at night, but once you're used to, take it in the morning. So best time is first thing in the morning, really.
Thank you so much, Deepika Ben. Dr. Deepika Ben, we are so privileged and honored to have you here.
Oh, thank you.
I had about 5-6 questions from our committee, which we will forward it to you for answers because we are running out of time. Yeah. And I'll pass it on to our chairperson. Panaben, over to you. Panaben?
Thank you, Jay. Thank you, Sandhya. I'm speechless, Deepika Ben. We don't know what to say. It's been absolutely fantastic. We've had floods of comment on how impressed and how well you've presented. It was educational, informative, very clear. So, you know, I haven't got any words on behalf of LCUK. All I can offer you is a massive, massive thank you for such a fantastic presentation. So, Dr. Deepika Ben-Thagrath, thank you so much.
Thank you. Thank you for having me. It is always a pleasure, you know that. And yes, I'm amongst you and I'm one of you. Please forward me any questions you have and I'll do my best to answer them.
Yeah, absolutely. But once again, Deepika Ben, thank you. A big round of applause. I know we can't all do it, but I'll do it on behalf of everyone who's here. Thank you so much. Very grateful.
Thank you for having me. It is absolute pleasure. Thank you for giving up this lovely sunny afternoon. As you can see, the sun is setting and it's so beautiful outside. So thank you for sitting to listen to something.
Well, it was very educational, and I have no doubt everybody up here or who's still logged in and who has logged in, you can see from the comments that everyone's really happy with the presentation and very, very impressed. So thank you so much once again. I'd like to take this opportunity also to thank the President, the Secretary, the Central Council members for supporting this event. It's been a fantastic event. And the Mahila Committee, LCUK Mahila Committee, who have been very, very supportive. I will say, Mina Ben, thank you for bringing this event forward. Sandhya Ben and Rajul Ben for forwarding all the questions. Jay Ruparel, who's our secretary, he has been working hard to make sure that everyone is spotlighted on time and operating being on the technical side. We have Dina Ben, Indira Ben and Rekha Ben. Thank you all very much for always being there, and your contributions for every event is highly appreciated. Like Sandhya said, that if there are any questions on behalf of some of the committee members, we'll put them forward. If it's okay with you, we will forward them to you, and if you wouldn't mind responding to them. We had run out of time, so we couldn't actually bring some of the questions up which came from the committee members. Hope that's okay with you, Deepika Ben.
Okay, yes, that's perfectly all right. I will do my best to answer. If anyone has any queries or things, please send email and I will do my best to answer. And if I don't know, I will know someone who will be able to.
I'm sure. That's very kind. As for everyone who's logged in, Lohana members, the public, people who've logged in on Facebook as well, a very big thank you for making the time. I hope it's been informative for you as well, and it's helped you in some way or the other. I'm sure it has, because Deepika couldn't be more clearer and everything was explained so well. So I'd like to thank you all for joining this session today. We are planning to have a few more sessions as well in future, and different kind of events as well. So please always look out for what we have in plan for future on our Facebook page. You can always get in touch with your local Mahajans to find out what LCUK is doing. You can come directly to LCUK, the secretary, the president, the committee members, the trustees. We're all here to help you. So please feel free to get in touch with everyone, because we have a lot more events coming very soon. So please look out for them. And all I can say is thank you very much once again. So
thank you everyone. Thank you to the committee for really giving up their time and all that effort in making this happen. I hope we all are aware of our
એટલે એમાં શું આપણે લગેજ બધું ના આવે સરખી રીતના એટલે કઈ લેવાની અમારે કઈ લેવાની પેટ્રોલ
Bye, everyone. Thank you, committee, for organizing everything.
Thank you. Bye, everyone.